Hello, my name is Kerwin Rice, and my capstone presentation is on the Federal Transit Administration's response to COVID-19 for public transit. My research question is, how effective was the FTA's support to transit operators to meet the mask mandate, recommended actions, and the safety advisory for PPE and deep disinfecting from the CDC and OSHA? The role of the FTA is to provide financial assistance, technical assistance, and safety measures. The FTA oversees safety measures for public transit systems, which include bus systems, subways, light rail, commuter rail, trolleys, and ferries. The FTA wants to be viewed as an industry leader in the promotion of safety, information sharing, and fair oversight. My findings as a result of the research is that financial assistance with the CARES Act was a home run by all the transit operators interviewed. It allowed transit operators to go above and beyond on their COVID-19 response. They could purchase additional PPE, cleaning equipment, such as electrostatic sprayers, and pay for additional cleaning staff. The initial response to the pandemic was chaotic, as we all know. There was not a game plan in place to follow the science. And that was one of the things discovered in my research, is that the information at the beginning was misaligned. The FTA quickly adopted to digital platforms to disseminate information on COVID-19 as it rapidly unfolded. Their technical assistance came in handy with a lot of information sharing and transportation resource sharing through webinars on a local, state, and national level. It was a team effort, as described by one of the transit operators, sharing best practices among the public transit sector. The safety measures and safety advisories with recommended actions to reduce the risk of exposure to COVID-19 to employees and passengers were in line with the CDC and OSHA recommendations. Overall, the support from the FTA was effective. The recommendations as a result of my research is that first, the FTA needs to develop a game plan, a framework for leading during a pandemic, especially at the initial response. The transit operators should also have an emergency initial plan customized to their service areas. This should be an industry standard and a lesson learned from the pandemic. Next, the transit operators should maintain CDC and OSHA cleaning and disinfecting standards from this point on. And finally, communication should be aligned and follow the science. Thank you very much, and that concludes my presentation.